Thank you. I would now like to welcome to the stage the director of the Henka project in Spain, which is doing some really innovative work to promote emotional well-being among children and adolescents. So, thank you.
Καλησπέρα. Ευχαριστώ την προσλέσκη. I try. So thank you so much for this invitation. It is an honor for us to be here today. Thank you to Stavros Foundation and Childmind Institute. Today we present a Henka project, a project dedicated to strengthening our mental well-being among young people and their environment in order to prevent mental health disorder. As we all know, and the increase of mental health disorders in adolescents has become an urgent issue in a worldwide, and the need of best intervention with effective improvements has never been greater. So we saw a large increase and dramatic increase in healthcare activity in Hospital San Joan de Déu in Barcelona. We saw since pandemic 19% of visit of camp and increasing, and 47% in emergency. Overall, a recent study of the barometer of youth health and well-being, we saw an increase of 59% that adolescents said that they think they have a mental health disorder. And another said that more than 70% when we ask if they feel distress, they say yes. But the concern is that mental distress is part of life. Maybe we don't worry about that. We worry about that maybe they don't have the adequate skills to cope with distress. But it's important to differentiate emotional well-being and mental health disorder. Emotional well-being is more influenced by for environmental factors. So that's a good notice, because these skills can be learned and the programs of prevention are the key. We have more good news. UNICEF and World Health Organization declares that to combat this issue and increase of mental health disorder, the key are the prevention programs, such as reinforcing resilience, in order to strengthen the protective factors. And I recommend, if you don't read the report from King's College that declares that these programs are cost-effective. So we did a pilot experience in Spain, in Catalonia. We designed a control group with intervention, and we performed a pilot reinforcing resilience in adolescents and their environment. We assessed around more than 900 students, and we saw that we use valid instruments. They say, okay, this intervention likes, we want to do it. Limited evaluation feasibility, but consistent with previous study, high acceptability of evaluation, and one thing important, they have perceived the use of the intervention and also a strong intention to take care for their well-being. So what is Henka? Henka, it's a project that begins with the collaboration of Z Zurich Foundation in 2022. And it's a program that the aim is to strengthen mental well-being with actions that reinforce resilience in adolescents, so individual, in familiar, and in society and their environment. So 3 dimensions, individual, familiar, and schooler. We have 2 big scopes. High schools, we work with 3 dimensions. How? Training by trainers to educators, psychologists. Then the adolescents receive sessions of reinforce their resilience, and parents receive sessions for reinforce their parent resilience as parenting. And also we have specific actions for vulnerable environments. On the other hand, citizenship, we organized an event in November of 2024, festival around mental well-being in youth, and we do also advocacy and communication strategies. We do prevention campaigns of young people. World program is supported by a platform of development Són 360 en Henka, you can check. We also been assessing all the program, and we have a communication plan. Henka is supported by validated programs, which we choose from Spain. Upper right is a program in Basque Country with resilience. We choose materials from Canada, the 4R, strategies for healthy youth and relationships, and materials from UNICEF, and materials from positive discipline for parents. All the program was manualized following the international guidelines, such as safe strategy and socio-emotional skills training, and we will be advised with an educational scope during all the process, and we continue assessing and improving all the program. There are two phases. In first, we do the sessions in secondary school. First and second, we work resilience individual and familiar. And then in third and fourth, we work with scholar resilience. How? Assessing a scholar resilience with a questionnaire validated. And then when we assess it, we propose specific activities for the school. So we try to change the culture. I think this morning somebody talks about that. It's not only a program. We need to change the mind, change the culture of the society or the school and their environment. Familiar resilience is worked by sessions in parents in first and second. And now we are recording a podcast because parents don't go to the sessions sometimes. So we are thinking, imagining ideas. So this is our way. There are 8 sessions, 5 social skills, include self-esteem, self-efficacy, emotional regulation, interpersonal skills, as empathy, consciousness. We also work with mindfulness and family, as I said at the beginning, parenting sessions. We are expanding around Spain. And regarding communication, we have the aim to make Henka a benchmark, raise awareness, and promote changes in attitudes. We have several actions, el Festival Viva la Vida, with more than 1,500 attendants. We have present in interview and national televisions, a pitch elevator with the King and the Queen from Spain. And to summarize our achievements, we have a relation very close to governments because it's the key of the promote the evolution, the program in Spain with Madrid, Catalonia, Valencia, and Aragon. And this course, we arrive at more than 7,000 adolescents, more than 900 educational professionals, more than 1,800 families, and 91 high schools. We hope this year arrive more than 70,000 adolescents, and we have audience in our communication. So I explained Henka, it's very nice and very fantastic, but what they think and feel about Henka?
El projecte Henka m'ha ajudat molt perquè a l'escola tractem altres assignatures com mates, llengua, història, i això és una cosa que no és ben bé un tema a estudiar, però és una cosa que t'ajuda a millorar amb tu mateixa i t'ajuda a millorar el teu benestar emocional i penso que és igual d'important.
Jo crec que tenir un espai en el que puguis parlar és bastant útil perquè les coses que et poden passar les pots explicar i que no les tinguis tan a dins.
El programa ens va ajudar bastant a, quan tenim un problema, pensar més, saber què fer i, per exemple, el primer de tot, parlar. Hem de parlar i amb calma.
A mi m'ha ajudat que si en algun moment no sé gestionar aquesta situació, poder parlar i no quedar-me pillada.
El programa Henka ens va agradar molt perquè també vam fer coses introspectives o, per exemple, vam fer sobre l'adolescència, que ens va ajudar molt cap al futur, i també la resiliència.
Jo crec que no se li dona la importància al benestar emocional que li tindríem que donar.
M'ha ajudat més a tenir més confiança en poder explicar les coses.
Progressivament, quan van anar avançant les classes, vaig anar a veure com van anar avançant les meves idees i com podia anar millorant jo, a poc a poc. I anava tot millor.
Just for finish and conclusion, Henka, it's a Japanese word that means change, means reborn, means to not to return at the starting point. This journey has become, is now a reality, and today I learned that this dream is shared for many of us, and we are ready to incorporate, to take care of the mental health well-being in our lives. Thank you so much.
Thank you, Esther. Thank you and congratulations to the Henka Project. Please welcome back to the stage Mr. Andreas Dracopoulos, Dr. Harold Koplowitz, and members of the Stavros Niarchos Foundation Global Center for Child and Adolescent Mental Health team.